Hi guys, so today is clinical day 4 and I'm actually here at a naturalistic holistic clinic to see how that varies from modern medicine or what they add. So I'm super excited to see the differences or maybe some of the neat things they may add that could actually be helpful. Well, I'm about to head in. When I come out, I will let you know how this experience is going. And this basically is an experience where I shadow. So I'm not doing really any hands-on, but I'm going to shadow this nurse practitioner from 9 to 4. All right. Talk to you soon. All right. Hi, guys. So I am at lunch right now. A little bit about what I've seen so far. We've seen 3 patients. And it's interesting because she does do what I consider Western medicine, but then adds in some of the other stuff like functional medicine. So it's been kind of neat to see too, because some of these issues that patients are having, she does additional tests that I know I've not seen them do in the hospital very often. So like things like she's checking for vitamin D, she's doing the vitamin B12s, the cortisol. She does additional testing on thyroid to look for Hashimoto's, to explain some of the reasons as to why they're feeling so tired. But it's been interesting so far. She does everything like you would see at a regular clinic. So she does, the SOAP note, so your subjective. She does the objective, where she does the physical assessment head to toe depending on what's going on, but then adds these additional tests, which I think is very interesting, to test for things to help the patient. One of the other things that I thought was interesting was the nutrition. So she wanted to get kind of down to the root of what they're eating and how much nutrients they're actually getting. For example, there was a girl that came in and she's having issues with sleep and depression. And so she started asking her, are you getting enough fruits and vegetables? She said no, so go ahead and give me a food diary. And in the food diary, you could see so clearly that this young lady eats nothing of nutritional value, nothing. And she did that over a few days of kind of getting an idea of what she ate. And if she's doing this for a long time, obviously there are definite nutritional deficits and probably affecting her metabolic systems. So she was going, my nurse practitioner that I'm following is going to do additional testing to see what deficits there are. And then apparently this intensive testing takes 3 weeks before you get the results back. So then the follow-up will come back in 3 weeks. All right, well, after lunch, I'll tell you a little bit more about what's going on, and we'll go from there. All right, guys, so I've dropped my daughter off for soccer practice and I thought I'd finish this video. So basically, the whole time I was there, that was from 9 to 4, we saw 6 patients, which is not very many in comparison to the other clinic, which was just, a family practice clinic. So it was nice in that she could spend a lot more time with the patients, but at the same time, that wasn't a lot of experience. But, different things for each person. If that's something that you're interested in, that's great. Me personally, I wouldn't be. I like the idea of functional medicine because of the different things you could test for and the different things you can treat, because nutrition does play a huge part in it. And I saw that in the clinic and how important it was for if you have deficits, nutritional deficits, metabolic deficits, that type of thing. They take care of those and you see huge gains. So it's too bad they can't combine the two, functional medicine and Western medicine, all in one. But it is what it is. So some of the things that they treat in this clinic are like, here I can show you, are arthritis, autoimmune, cancer, chronic pain, fatigue, mood disorders, PTSD, women's health. And you can read through the rest of that. They also do some minor ones, such as they treat minor ailments such as asthma, allergies, infections, and UTIs. Now this clinic does more than just, ooh, we see the sun coming in. I'm going to move you a little bit. This clinic does a little bit more in that they do the primary health care, the counseling, health coaching, yoga, massage, body work, nutritional services, acupuncture, meditation, and mind and body medicine classes. So, I mean, all of it's there in one place. I think it's a neat concept, something different. As a nurse practitioner, it looks like you can do a number of broad areas, specialty to more family practice or general medicine. And then here, you got functional medicine. All right, thanks for joining me.